Hi, I'm Dr. Richard Huntoon from Advanced Alternative Medicine Center, and I want to talk to you today about medications. If you've ever been asked to take medication, you need to strongly consider the following questions before you begin them, or you certainly want to think about asking them now that you're currently taking the medication. First and most important question is will this medication fix my problem, or will it simply mask the symptoms and make me unaware of the problem that's still there? That's an important question to consider because if you're just simply masking the problem without addressing the underlying cause, your problem's going to get bigger over time. Will probably get worse over time. But they're interested in the surgery that's waiting for you down the road rather than fixing your concern. So that would be important for you to consider. Second question you want to ask is, how does the medication work? Does it, again, go after the underlying physiological mechanism, or does it block something from happening the way that it's supposed to, which ultimately is going to lead to side effects? And we all know that side effects is your body's way of telling you it's not the right answer for my particular problem. Number three, is there any way else to treat my body other than taking the medication itself? Is there another form of care that could be given versus just simply taking the medication? That's something that you want to consider. What will a medication do for me, both in a positive sense and in a negative sense? And you really want to understand the negative sense because that's something that you're going to be living with. Again, those are your side effects. What's the most common side effect that I should potentially be aware of? And what are the less common side effects that I should be aware of? Because when you start to have these kinds of side effects, if you don't attribute them to the medication, okay, you may go into your doctor and say, I have a new symptom going on, or I have this new condition going on, and they may give you a new medication to go along with the current medication. What's the follow-up treatment to the side effects that I may be getting from the medication? Is there going to be some sort of therapy that I need to go through? Are they going to give me another medication to mask the first symptoms associated with the medication that I'm taking? Will it affect my ability to concentrate, do my job? Will it affect my appetite? Will it affect my sleep? I guess this is important too. Will it affect my ability to conduct relations with my significant other, my wife, etc.? That would be important. Do I need to take my medication with food? What happens if I miss a dose? Do I just take it when I remember, or do I have to wait until the next time that I'm supposed to take it? Do I take an extra dose if I've missed a dose? What's the truth about that? Will it cause me to gain weight? This is something that most people don't ever consider, and unfortunately when they start their medications, then they put on all this extra weight and then they become a completely different person. And had they known ahead of time, they wouldn't have taken the medication because they were concerned about creating weight. Are there any problems if I stop the medication? Can I just simply stop the medication? There's a lot of warnings that say, talk to your doctor if this is a problem for you, because you can't just stop the medication. You want to make friends with your pharmacist where you get the medication from, because a lot of times they can answer questions for you when your medical doctor doesn't necessarily know specifically how to answer that question for you. And finally, if the medication doesn't work, what is the next course of action? Is it going to be a stronger medication? What is the next step in your process related to the medications and the symptoms that you're dealing with? So I hope these questions that I've given you are going to give you something to consider, and go into your doctor and ask these questions before, during, or the medications that you're being given. If you have any questions or any other concerns, if you'd like to find a different way to help yourself without all the medications, please consider contacting my office directly. Our phone number is 845-561-BACK or 561-2225. Or you can email me directly at docrick@spineboy.com. That's DOCRICK@spineboy.com. And it certainly would be my pleasure to help you to better understanding on how to not have to go on medication by dealing with the underlying cause of your concern. Advanced Alternative Medicine Center, serving all your healthcare needs naturally. I thank you for your time, and I thank you for your consideration, and I would look forward to meeting you.